Hello, we are the school age group. This is Gabriel Dunford. I'll be starting with vitals and physical assessment. Most of these things, they're already at the point to where they're starting to be like an adult. Their heart rate will be 50 to 90 beats per minute. Their respiratory rate 15 to 25. Temperature 98.1. And capillary refill should already be less than 2 seconds. We usually don't use blood pressure, but if we do, a good way to know a normal would be their age times 2 plus 80. Their skin should be warm with pink undertones. They shouldn't have any edema. Their capillary beds should be pink or at least a brighter color, and it should be quick to return when pinched. For their head, it should be symmetric. Moving down to their eyes, they should have perla. Everything's still the same as an adult. The white sclera, pink conjunctiva. Pinna should be pulled up and back to see their tympanic membrane, which should be a pearly pink or gray. To test their vision or hearing, the vision would be the Snellen letter chart, and their hearing would be tone audiometry. Going down to their nose, it should also be symmetrical. When you look inside, you should see 3 turbinates on each side of the inner nose. The mucosa should also be pink, and you should make sure that they have an undeviated septum, also like an adult. Their mouth, also symmetrical. Make sure their hard and soft palate completely cover the top of their mouth. That's a big thing with them that some people don't catch. The tip of their tongue should at least reach their lips. Their chest and limbs is the next thing. Their chest should also be symmetric. It should rise, whether you're looking in the front or the back, you should see it rise in a symmetrical way and evenly. The AP diameter should be half of the transverse, also like an adult. Breath sounds audible but clear. Heart sounds should be clear. And the abdomen should look flat while they're supine, and it shouldn't be tender at all unless they have a full bladder. Bowel sounds should be present, and once we're going to their joints, they should have no pain in a full range of motion. I mean, some kids are more flexible than others, but it shouldn't hurt them. All of their pulses should be palpable. I mean, at this point, their arteries are nice and clean. All of their reflexes should be present. Their Achilles, patellar, bicep, and tricep.
My name is Madeline, and I'm going over fine motor development. Fine motor skills involve the use of the small skeletal muscles, and that's basically going to be focusing on your hands and involving activities such as grasping items, so holding a pen, using scissors, flipping through pages such as the newspaper while in the bathroom. When I was observing my clients, they were 5 and 6 years old, they definitely had many opportunities to utilize their fine motor skills, and I was actually very impressed with their abilities. They actually went to computer class and were able to do the Control-Alt-Delete sequence without any difficulty. They were able to use the mouse, highlight and click, and then type in a username and password, and I was just blown away by the fact that they could do that with their tiny little hands. And then when we went back to class, in their phonics class, they were able to do handwriting and use a pen and trace their letters. They also cut on the dotted line, and then they were able to fold papers in half and then in fourths. They also used a lot of the small Legos and things like that during indoor recess. While at lunch, they definitely used the forks and the spoons and could pick up snacks with their hands. The only difficulty I saw there was that they kept going to the teacher to have them open the packages because they had a little difficulty with that. And then back in phonics class, I did notice that they did have difficulty with handwriting. There was actually about 3 or 4 students that were separated from the rest of the group and had a one-on-one interaction with the teacher because they were a little bit slower and had more difficulty with writing and tracing their letters. And so that's something to definitely note when you're observing kids and their fine motor skills, because it is shown that about 6% of all children develop a motor skill disorder. So then for gross motor skill development, gross motor skills involve the use of the larger skeletal muscles. And so that's going to be doing the more outdoors things such as running, jumping, skipping, kicking a ball, throwing a ball. So pretty standard things for most school-age children. When I observed my clients, they definitely were able to show me all their gross motor skills. They actually had PE, and the coach actually told them to run up and down the basketball court, hop on one foot, balance on one leg. They actually played a game where they threw balls at each other. They didn't exactly grasp the concept of the game, but they were able to run around and throw the ball. And then they were dancing, clapping, and did a lot of things with that. The only thing I noticed in that sense was that they did have difficulties with balancing. And they're not too far with on the developmental milestone because it's about 5 seconds that they can hold a balance by 6 years old, so they're a little bit behind. But I did note that there was a study that they did with ADHD and showing a positive correlation between having ADHD and lacking the ability to balance because of their altered sensory perception. So it's just something to note and just watch how the kids are in relation to other children and their developmental milestones, because it is shown that if they do have issues and maybe they're a little clumsier than the others or don't have an ability to ride the bike, you could watch out for things such as cerebral palsy.
So this is Sharon, and I'm covering activity and exercise, and I think the first thing that I noticed when I was watching the school I was with, third graders, is, oh my gosh, they're physically active, they're in constant motion. And between 6 and 12 years of age, there are just huge differences in their changes in their motor skills and their play activities. So I've kind of broken this down into younger school age and older school age because there's such a vast difference. The younger school age continue to participate in unorganized play. They do a lot of it, biking, swimming, skateboards. The girls were outside looking at spiders in the playground. And at this age, they still like to do a lot of things with their parents. So parents are welcome in their activities, and that's going to kind of change as they get older. They begin to participate as they go into school in a lot of organized activities. These teach the children about group functioning, group dynamics, and this is everything from Little Leagues, baseball, soccer, scouts, 4-H. There's a whole big amount of activities for this group of children. They also have a lot of individual activities, and that will be gymnastics, musical instruments, karates, even things like Guitar Hero and the computer games. But of all of the things, what's really important is that the children gravitate to the kind of activities that fit their personality. And a little later there's going to be the discussion on temperament, but goodness of fit and and activities matching the child's temperament is a really important part of successful play. As the child gets older, the role of the parents lessens. In fact, they would just as soon not have the parents be involved in their play anymore, and peer group reactions become more important. School-sponsored activities begin to dominate a lot of the children's time. Baseball, soccer, band, cheerleading. These then actually continue up into their older school-age years. But the encouragement of both solitary and group activities are really good for a child's development. What's important, and I actually noticed it as we were on the playground, is that the children are going to be demonstrating a wide variety of skills. They all are going to develop at a different physical rate. One of the girls in the class that I was watching was very, very large compared to the rest of her group, and she sort of towered. She could do lots of things, and she could take out the boys, and that's not necessarily a good thing for her emotional development. But this is a time period where bullying really becomes a problem, and bullying should not be tolerated in the schools.